Hello dear friends, this is video number 11 and the last video in our Management of Information series. For more videos, please visit my Facebook page, Healthcare Quality. In this video, we will talk about some medical examples that show the value added by information systems. The first example is about scheduling, considered as a transaction processing system (TPS), a strategy for transforming health service delivery. Because appointment is the portal through which providers and healthcare organizations deliver services, strategic scheduling represents a key agent for transformation of service delivery. The scheduling system that's needed is the one that not only simplifies the scheduling process so that patients can easily, conveniently obtain the services they need, but also helps manage cycle time and makes optimum use of scheduled resources. It also provides a real opportunity to address customer attitudes and behaviors that support successful relationship marketing. After scheduling an appointment with Dr. Parson through Mainland Health System webpage, ambulatory scheduling, Keith Sims uses his health plan card to indicate arrival at Westchester Clinic. Customer self-service check-in. The health information system updates Mr. Sims' appointment from scheduled to arrived, which initiate the revenue cycle for the service to be performed and automatically starts the eligibility check, automated eligibility checking. Mr. Sims confirms his demographics and reviews the results of eligibility inquiry. While seeing Dr. Parsons, Mr. Sims complained about a sharp recurring pain in his left leg. Through the physician workstation, Dr. Parson ordered an X-ray, MRI studies, and requested a follow-up appointment with Mr. Sims when the tests are completed. The system confirms medical necessity checking. From the checkout workstation, the receptionist is alerted to collect the required copay and schedule the 3 appointments for Mr. Sims displayed on the scheduling work list. The system is knowledgeable about patient preferences, clinical protocols, appointment sequencing, and specific clinical alerts associated with the service being scheduled. While scheduling the MRI, the system checks the specific clinical requirements and finds that Mr. Sims doesn't have any foreign metal objects in his body, such as a pacemaker or shrapnel. But he does have claustrophobia and must be scheduled for an open MRI, so an appointment test location is suggested. Based on his contact preferences, Mr. Sims receives an email confirmation in advance of his appointments. The confirmation includes preparation instructions, directions to the test locations, and estimated copays. When he meets with Dr. Parsons for his follow-up appointment, she ordered physical therapy, 3 one-hour sessions per week for 4 weeks. The system confirms medical necessity and processes the referral. Mr. Sim's schedule doesn't permit regular appointments, so he will request these appointments from home where he can consult his personal and work calendar. He places the request using his home computer. The system places the requested appointments on a scheduler work list and sends Mr. Sims an appointment confirmation by email. If Mr. Sims had not requested these appointments within a defined time frame, the system would alert a scheduler to contact him to follow up. Patient compliance is mentioned in each step in the care process, regardless of who is responsible for the task. Mr. Sims doesn't achieve the expected clinical outcome with physical therapy. The system coordinates the scheduling of an appointment with Dr. Parsons and the referral to an orthopedic specialist. As a result of the appointment, the orthopedic specialist determines that Mr. Sims needs a surgical procedure. Before leaving the office, Mr. Sims had a scheduled appointment for the surgical procedure as well as necessary pre-admission testing based on clinical protocols. The system coordinates all necessary steps to ensure best practice will be followed. These best practices are designed to result in the desired patient outcomes. These scheduling capabilities address the needs of the patient, provider, and health system by planning and synchronizing care across inpatient, outpatient, and ambulatory care settings. By keeping the focus on the patient, the health system builds customer loyalty while optimizing its service capabilities. This is only possible once scheduling is no longer viewed as a separate tactical function, but an intrinsic part of a holistic service that treats the whole person. The second example is performance measures indicators that are in fact management information systems. Indicators may be used to assess an outcome or a process of care. Outcome indicators measures what happens or doesn't happen as a result of a process or processes. Process indicators measure a discrete activity that's carried out to provide care or service. Performance analysis should include comparison of actual performance data with a benchmark, previous validated data, an aggregated rate over time, or another equally significant signal. Such a comparison will assist in answering the question, based on this data, should we initiate more intense analysis of this process? Our third example is clinical decision support systems. They provide clinicians, staff, patients, and other individuals with knowledge and person-specific information intelligently filtered and presented at appropriate times to enhance health and healthcare. A large part of any physician's work, especially in non-procedural disciplines, involves acquiring information and then, aided by evidence and experience, making decisions for the best possible outcome. In earlier days, this whole process could take place in the brain of the practitioner. However, With the rapidly increasing amount of data now available for each patient and the increasing body of medical evidence, we need tools to help us make rational decisions based on all this information. Early clinical decision support systems were derived from expert system research, with the developers striving to program the computer with rules that would allow it to think like an expert clinician when confronted with a patient. From this early research, there was growing recognition that these systems could be used to assist clinicians in decision making by taking over some routine tasks, warning clinicians of potential problems or providing suggestions for clinician considerations. The most common use of clinical decision support systems is for addressing clinical needs, such as ensuring accurate diagnosis, screening in a timely manner for preventable diseases, or averting adverse drug events. However, they can also potentially lower costs, improve efficiency, and reduce patient inconvenience. In fact, they can sometimes address all three of these areas simultaneously. For example, by alerting clinicians to potentially duplicate testing. For more complex cognitive tasks, such as diagnostic decision making, the aim of clinical decision support systems is to assist rather than to replace the clinician. Whereas for other tasks, such as presentation of a predefined order set, they may relieve the clinician of the burden of reconstructing orders for each encounter. The clinical decision support systems may offer suggestions, but the clinician must filter the information, review the suggestions, and decide whether to take action or what action to take. Common features of clinical decision support systems that are designed to provide patient-specific guidance include the knowledge base. For example, combine the clinical information on diagnosis, drug interactions, and guidelines. A program for combining that knowledge with patient-specific information and a communication mechanism and providing relevant information back to the clinician. Clinical decision support systems can be implemented using a variety of platforms: internet-based, local personal computers, networked EMR, or a handheld device. Also, a variety of computing approaches can be used. Benefits from them include improved patient safety, improved quality of care, and improved efficiency in healthcare delivery. Here, you can review some of the clinical decision support system interventions by target area of care. Some clinical decision support systems have the capacity to learn, leading to the discovery of new phenomena and the creation of medical knowledge. These machine learning systems can be used to develop the knowledge bases used by expert systems, assist in the design of new drugs, advance research in the development of pathophysiological models from experimental data. It's crucial that clinicians be involved in the development and rigorous scientific evaluation of these systems. Clinicians are also best placed to decide how these systems should be implemented in local care environments. We urge clinicians to identify opportunities for clinical decision support systems and to advocate within their healthcare settings for the development of systems that bring about meaningful improvement of health outcomes. Now, we will talk about the newly developed artificial intelligence applications in healthcare. Artificial intelligence in healthcare is an overarching term used to describe the use of machine learning algorithms and software to mimic human cognition in the analysis, presentation, and comprehension of complex medical and healthcare data, or to exceed human capabilities by providing new ways to diagnose, treat, or prevent disease. Research in 1960 and 70 produced the first problem-solving program or expert system known as Dendral. While it was designed for applications in organic chemistry, it provides the basis for a subsequent system, Mycin, considered one of the most significant early uses of artificial intelligence in medicine. Greater consideration is being given to the unprecedented ethical concerns related to its practice, such as data privacy, automation of jobs, and representation biases. Some medical and technological advancements occurring over this half-century period that have enabled the growth of healthcare-related applications of artificial intelligence to include improvements in computing power resulting in faster data collection and data processing, growth of genomic sequencing databases, widespread implementation of electronic health record systems, improvements in natural language processing and computer vision, enabling machines to replicate human perceptual processes, enhanced precision of robot-assisted surgery, increased tree-based machine learning models that allow flexibility in establishing health predictors, improvements in health learning techniques and data logs in rare diseases. Electronic health records are crucial to the digitalization and information spread of the healthcare industry. Now that around 80% of medical practices use them, the next step is to use artificial intelligence to interpret the records and provide new information to physicians. Examples of clinical applications of artificial intelligence. Cardiovascular. They show potential as an initial triage tool. Wearables, smartphones, and internet-based technologies have also shown the ability to monitor patients' cardiac data points, expanding the amount of data and the various settings. Artificial intelligence models can be used and potentially enabling earlier detection of cardiac events occurring outside of the hospital. In dermatology, dermatology is an imaging abundant specialty, and the development of deep learning has been strongly tied to image processing. There are three main image types in dermatology: contextual images, macro images, and micro images. For each modality, deep learning showed great progress. A concern raised with this work is that it has not engaged with disparities related to skin color or differential treatment of patients with non-white skin tones. In 2018, a paper published in the journal Annual of Oncology mentioned that skin cancer could be detected more accurately by an artificial intelligence system than by dermatologists. In gastroenterology, endoscopic exams such as esophagogastroduodenoscopies and colonoscopies rely on rapid detection of abnormal tissue. By enhancing these endoscopy procedures with artificial intelligence, clinicians can more rapidly identify diseases, determine their severity, and visualize blind spots. In infectious diseases, a scoping review of the literature found few examples of artificial intelligence being used directly in clinical practice during the COVID-19 pandemic itself. Other applications include support vector machines identifying antimicrobial resistance, machine learning analysis of blood smears to detect malaria, and improved point-of-care testing of Lyme disease based on antigen detection. Additionally, artificial intelligence has been investigated for improving diagnosis of meningitis, sepsis, and tuberculosis, as well as predicting treatment complications in hepatitis B and hepatitis C patients. In musculoskeletal disease, artificial intelligence has been used to identify causes of knee pain that doctors miss. Researchers have conducted a study using a machine learning algorithm to show that standard radiographic measures of severity overlook objective but undiagnosed features that disproportionately affect the diagnosis and management of underserved populations with knee pain. In oncology, artificial intelligence has been explored for use in cancer diagnosis, risk stratification, molecular characterization of tumors, and cancer drug discovery. In January 2020, researchers demonstrated an artificial intelligence system based on a Google DeepMind algorithm capable of surpassing human experts in breast cancer detection. In July 2020, it was reported that an artificial intelligence algorithm developed by the University of Pittsburgh achieved the highest accuracy to date in identifying prostate cancer with 98% sensitivity and 97% specificity. In ophthalmology, in 2018, the US Food and Drug Administration authorized the marketing of the first medical device to diagnose a specific type of eye disease, diabetic retinopathy, using an artificial intelligence algorithm. Moreover, artificial intelligence technology may be utilized to further improve the diagnosis rate because of the potential of decreased detection time. In pathology, methods of digital pathology allows microscopy slides to be scanned and digitally analyzed. Artificial intelligence-assisted pathology tools have been developed to assist with the diagnosis of a number of diseases, including breast cancer, hepatitis B, gastric cancer, and colorectal cancer. Artificial intelligence is well suited for use in low complexity pathology analysis of large-scale screening samples, such as colorectal or breast cancer screening, thus lessening the burden on pathologists and allowing for faster turnaround of sample analysis. Artificial intelligence also has the potential to identify histological findings at levels beyond what the human eye can see, and has shown the ability to utilize genotypic and phenotypic data to more accurately detect the tumor of origin for metastatic cancer. In primary care, artificial intelligence has been used for supporting decision-making, predictive modeling, and business analytics. In psychiatry, artificial intelligence applications are still in a phase of proof of concept. Areas where the evidence is widening quickly include predictive modeling of diagnosis and treatment outcomes, chatbots, conversational agents that imitate human behavior and which have been studied for anxiety and depression. Artificial intelligence is being studied within the field of radiology to detect and diagnose diseases through computerized tomography and magnetic resonance imaging. Artificial intelligence can also provide non-interpretive benefit to radiologists, such as reducing noise in images, creating high-quality images from lower doses of radiation, enhancing MR image quality, and automatically assessing image quality. Further research investigating the use of artificial intelligence in nuclear medicine focuses on image reconstruction, anatomical landmarking, and enablement of lower doses in imaging studies. Medical systems applications of artificial intelligence. Disease diagnosis. Through the use of medical learning classifiers, artificial intelligence has been able to substantially aid doctors in patient diagnosis through the manipulation of mass electronic health records. The implementation of artificial intelligence to not only help find similar cases and treatments, such as through early predictors of Alzheimer's disease and dementias, but also factor in chief symptoms and help physicians ask the most appropriate questions that helps the patient receive the most accurate diagnosis and treatment possible. Combining the skills of medical professionals and the machine can help overcome decision-making weaknesses in medical practice. To do so, one needs precise disease definitions and a probabilistic analysis of symptoms and molecular profiles. In telemedicine, artificial intelligence can assist in caring for patients remotely by monitoring their information through sensors. A wearable device may allow for constant monitoring of a patient and the ability to notice changes that may be less distinguishable by humans. Drug interactions. Drug-drug interactions pose a threat to those taking multiple medications simultaneously, and the danger increases with the number of medications being taken. To address the difficulty of tracking all known or suspected drug-drug interactions, machine learning algorithms have been created to extract information on interacting drugs and their possible effects from the medical literature. Organizations such as FDA, Adverse Event Reporting System, and the World Health Organization VGBase allow doctors to submit reports of possible negative reactions to medications. Deep learning algorithms have been developed to parse these reports and detect patterns and that imply drug-drug interactions. Industry. The trend of large health companies merging allows for greater health data accessibility. Greater health data lays the groundwork for the implementation of artificial intelligence algorithms. With the market for artificial intelligence expanding constantly, large tech companies such as Apple, Google, Amazon, and Baidu all have their own artificial intelligence research divisions, as well as millions of dollars allocated for acquisition of smaller artificial intelligence-based companies. IFLitic launched a service robot, Zioman, which integrated artificial intelligence technology to identify the registered customer and provide personalized recommendations in medical areas. It also works in the field of medical imaging. Many automobile manufacturers are beginning to use machine learning healthcare in their cars as well. Companies such as BMW, General Motors, Tesla, Toyota, and Volvo all have new research campaigns to find ways of learning a driver's vital statistics to ensure they are awake, paying attention to the road, and not under the influence of substances or in emotional distress. Neuralink has come up with a next-generation neuroprosthetic, which intricately interfaces with thousands of neural pathways in the brain. Their process allows a chip, roughly the size of a quarter, to be inserted in place of a chunk of a skull by a precision surgical robot to avoid accidental injury. United Nations WHO ITU. The joint ITU-WHO focus group on artificial intelligence for health has built a platform known as ITU-WHO Artificial Intelligence for Health Framework for the testing and benchmarking of artificial intelligence applications in health domain. As of November 2018, 8 use cases are being benchmarked, including assessing breast cancer risk from histopathological imagery, guiding antivenom selection from snake images, and diagnosing skin lesions. Thank you.